8 early signs of vascular dementia. And here's the truth most families don't realize. Almost everyone misses number 2. Your mother forgot where she parked the car. Again. Your father asked you the same question 3 times in 1 hour. You probably shrugged it off. You told yourself, it's just getting older. Most families do. But what if I told you these moments may not be normal aging at all? What if they're early warning signs of something far more serious? Something doctors can actually help with if it's caught early. Vascular dementia is the second most common type of dementia, right after Alzheimer's. It affects millions of adults over the age of 60, especially those with high blood pressure, diabetes, or heart disease. And here's what shocked me when I researched this topic. Most people miss the earliest warning signs for months, sometimes years. By the time medical help is finally sought, permanent brain damage has already occurred. That's why this video matters. Today, I'm going to walk you through 8 early warning signs of vascular dementia that every adult over 60 and every family member needs to recognize. Sign number 2 is so subtle, even people living in the same house often miss it completely. But once you know what to look for, you'll never ignore it again. Important medical disclaimer. Before we go any further, I need to be very clear. This video is for education and awareness only. It does not diagnose anyone. If you notice any of these signs in yourself or someone you love, you must speak with a doctor immediately. Only a medical professional can properly evaluate and diagnose vascular dementia. These signs alone don't confirm anything, but they are powerful reasons to seek medical attention early. And early action can make a life-changing difference. Let's begin. Let's start with a sign most people never expect because it doesn't look like memory loss at all. Sign number 8, sudden trouble planning or organizing. This is not about forgetting an appointment once in a while. This is about a sudden change in abilities someone has handled easily for decades. Picture this. Your father has made the same Sunday breakfast every week for 20 years. Eggs, toast, bacon, coffee, always the same order. Then one Sunday, something feels off. He's standing in the kitchen, confused. The eggs are burning. The toast is still cold. The coffee hasn't even started. He looks lost, inside a routine he once did without thinking. That's not normal aging. Doctors call this executive function decline, and it's often one of the earliest warning signs of vascular dementia. Here's why this happens. Vascular dementia develops when blood flow to the brain is reduced, often due to small silent strokes or damaged blood vessels. When these tiny strokes affect the parts of the brain responsible for planning and organization, abilities can disappear suddenly, sometimes overnight. This is very different from Alzheimer's disease. Alzheimer's usually progresses slowly over many years. Vascular dementia happens in steps. Someone seems fine, then a small stroke occurs, and suddenly their abilities drop to a lower level. What makes this sign so easy to miss? Families naturally step in to help. You start paying the bills. You organize medications. You plan meals. You think you're just being helpful, but without realizing it, you may be covering up a serious medical warning sign. If you notice a loved one suddenly struggling with tasks they once handled easily, don't wait. Write down what you're seeing. Note when it started. Then schedule a doctor's appointment as soon as possible. Early treatment can slow progression and protect brain function. But there's a sign that often appears even earlier than this one, and it shows up after the sun goes down. Sign number 7, increased confusion or disorientation at night. Often dismissed, but extremely important. During the day, everything seems fine. Your mother is alert. She remembers names. She follows conversations. She looks completely normal. But then evening comes. As the sun goes down, something changes. She starts asking what day it is. She can't remember if she already ate dinner. She may suddenly say she needs to go home, even though she is home. She looks anxious, restless, confused. Family members often say, "She's just tired. It's been a long day. She didn't sleep well last night." But this is not ordinary tiredness. Doctors call this sundowning, and this is one of the earliest warning signs of vascular dementia. Here's what's really happening. In vascular dementia, damaged blood vessels can't deliver enough oxygen to the brain. As the day goes on, the brain becomes more fatigued, and the areas already affected by poor blood flow begin to struggle even more. Add one more factor: low light. In the evening, shadows increase, visual cues disappear, and the brain loses important information it relies on to stay oriented. That's when confusion spikes. Research shows this pattern often appears months before other symptoms become obvious. And here's why this sign is so dangerous. Families almost always ignore it. They adjust routines, they give reminders, they are reassured, but they don't seek medical help. If you notice confusion that appears regularly in the evening, this deserves immediate medical attention. What you should do? Keep a simple journal for 2 weeks. Write down what time the confusion starts, what behaviors appear, how long it lasts, what seems to make it worse or better. This information is incredibly helpful for doctors, because when this pattern shows up early, intervention can slow further brain damage. But now we reach the sign that almost everyone misses, the one that shocks families the most. It has nothing to do with memory, it has nothing to do with conversation, and yet it may be the earliest physical clue that vascular dementia is developing.
Sign number 6. Trouble finding common words during conversation. Often mistaken for just forgetting, but it's not. Let's be honest, everyone forgets a word once in a while. That part is normal. But this is different. The person starts a sentence confidently, then suddenly they stop, mid-sentence. You can see it on their faces. They know what they want to say. The idea is clear in their mind, but the word itself is gone. They pause, they struggle, they feel frustrated. Instead of saying refrigerator, they say the cold thing, where food goes. A fork becomes a spoon. A car becomes that driving thing. And this doesn't happen once. It happens multiple times in the same conversation. Here's what makes this important. In vascular dementia, word-finding problems often appear suddenly, not gradually. One day, speech seems normal. The next day, simple words disappear. Why? Because small strokes interrupt blood flow to the brain's language centers. Some days those areas work better, other days they don't. That's why this symptom can seem inconsistent and easy to dismiss. But there's something families often miss: the emotional impact. The person knows something has changed. They feel embarrassed. They worry others will notice, so they talk less. They avoid phone calls. They withdraw from conversations. Family members think they're depressed. They're just quieter now. They don't feel like talking. But in reality, they're trying to hide a symptom. If you notice frequent word struggles, don't rush them. Don't finish sentences for them. Give them time. But do document it. Write down how often it happens, when it started, whether it varies day to day. Then bring this information to a doctor. Speech changes are neurological symptoms, and they deserve proper medical evaluation. Now, let's move to a sign that shows up during family time, TV time, and social gatherings. This one quietly changes how a person connects with the world. Sign number 5. Difficulty following conversations or TV shows. Your father is watching his favorite show, the same program he's followed for years. Suddenly he asks, "Who is that? What's happening? Why are they doing that?" You explain. 5 minutes later, he asks again. This is not a hearing problem, it's a processing problem. In early vascular dementia, the brain struggles to hold information, connect details, and keep track of what just happened. Doctors call this working memory decline. Think of working memory like a mental notepad. It holds information temporarily so the brain can make sense of it. Vascular dementia damages this system. So conversations become hard to follow, TV plots feel confusing, group discussions feel overwhelming, family gatherings turn stressful, too many voices, too much noise, topics changing quickly. The person can't keep up. So what do? They withdraw, they sit quietly, they stop participating, they avoid social situations they once enjoyed. Family members misinterpret this. They think they've lost interest, they're becoming antisocial, they just feel tired. But in reality, they're trying to hide a symptom. If you notice frequent struggles to follow conversations, reduce background noise, speak one person at a time, keep explanations simple, and most importantly, schedule a cognitive evaluation. These changes signal specific brain involvement that doctors need to assess. Now we come to a sign that surprises almost everyone because it looks like a vision problem, but it's actually happening in the brain. Sign number 4, problems with depth perception and spatial awareness, often blamed on eyesight, but the eyes aren't the problem. This sign shows up in small, surprising ways. Your loved one reaches for a cup and misses it. They misjudge the curb and stumble. They bump into door frames they've walked through for years. Parking the car suddenly feels stressful. Stairs feel confusing. Each step looks the same height. Families often say they need new glasses. It's just vision changes. They're just being clumsy. But here's the truth. Their eyes may be seeing just fine. The problem is in how the brain interprets what the eyes see. Vascular dementia damages areas of the brain that handle depth perception, distance judgment, and spatial awareness. The brain no longer can accurately judge where objects are in space. That's why drinks spill, why steps are missed, why falls suddenly increase. And here's the most dangerous part. The person often doesn't realize anything is wrong. Their brain isn't sending warning signals, so they continue driving, using stairs, moving quickly. This greatly increases the risk of falls, fractures, car accidents. Watch for these warning clues: spilling drinks when setting them down, trouble parking, bumping into furniture, difficulty with puzzles or crafts, new fear of stairs. These are neurological red flags, not normal aging. If you notice these changes, seek medical evaluation immediately. Early action can prevent serious injuries and further brain damage. Now we move to a sign that affects emotions and personality. This one is especially painful for families because it feels personal, even though it isn't.
Sign number 3, subtle changes in walking or balance. The most overlooked warning sign. Here's the truth most people don't know. How you walk reflects what's happening inside your brain. Walking isn't automatic. It requires coordination, balance, planning, timing, and all of that happens in the brain. In early vascular dementia, walking often changes before memory does, but the changes are subtle. The person starts taking shorter steps. They walk more slowly, especially when talking at the same time. Their feet may shuffle slightly. They hesitate at curbs, doorways, or stairs. Turning feels awkward. Family members usually say, "It's just aging, probably arthritis. They're just being careful." But here's what research discovered. Years before a diagnosis, people who later developed vascular dementia showed slower walking speed, shorter stride length, and poor balance during turns. This happened up to 3 years before memory symptoms appeared. Why? Because vascular dementia damages the brain areas that control movement and coordination. The brain knows what it wants the body to do, but the signals don't travel smoothly anymore. Here's a critical clue families miss. Watch what happens when the person walks and talks at the same time. If walking becomes worse while answering a question, that's a red flag. The brain can no longer handle both tasks at once. If you notice walking changes along with any cognitive or emotional symptom, do not ignore it. Request a full neurological evaluation. Do not accept just aging as an answer. And now, let's talk about a sign that shows up during everyday conversation, one that often leaves the person feeling embarrassed and frustrated. Sign number 2, sudden emotional changes or loss of emotional control. Your mother was always calm and steady. Now she cries during a TV commercial. Your father rarely raised his voice. Now he snaps over something small. These changes feel shocking and often hurtful. But this is not a character flaw. It is not intentional, and it is not just stress. This is a neurological symptom. In vascular dementia, small strokes damage the brain areas that regulate emotions. The emotional brakes stop working properly, so emotions come out too strong, too fast, too intense. A small irritation becomes anger. A mild sadness becomes uncontrollable crying. Sometimes emotions don't match the situation at all. Doctors call this emotional lability. And here's what families often don't realize. These outbursts are not directed at you. The person often feels confused or embarrassed afterward. They may not understand why they reacted that way. Families delay seeking help because they think they're depressed, they're stressed. We just need better communication. But emotional changes are often one of the earliest warning signs. Watch for sudden mood swings, strong reactions that fade quickly, crying or laughing that feels excessive, flat emotions when feelings should be present. If emotional changes appear along with any other sign we've discussed, medical evaluation is critical. Treatment can help manage these symptoms, but only if doctors know what's happening. And now, we arrive at the earliest and most surprising sign of all. Almost no one connects this symptom to brain health, yet it may appear before memory problems even begin. Sign number 1, sudden urinary urgency or frequency. The earliest sign almost everyone misses. This sign surprises nearly everyone because most people don't connect bladder changes with brain health, but the connection is real and important. Here's what it looks like. A person suddenly feels an intense, urgent need to urinate. It comes on fast. There's little warning. They may rush to the bathroom. Sometimes they don't make it in time. Medical tests show no infection, no prostate problem, no clear bladder disease. So everyone says, it's just aging. It happens to everyone. But here's what's really happening. The brain controls bladder timing and control. Specifically, the frontal areas of the brain act like a switch, telling the bladder when to hold and when to release. In early vascular dementia, small strokes disrupt these signals. The bladder sends urgency signals too early, or the brain doesn't respond until the last moment. This is why urinary urgency can appear before memory loss. Research shows this symptom appears in a significant number of people with early vascular dementia, often months before families notice cognitive changes. And here's the biggest problem. Doctors often miss the connection. Tests come back normal, no infection is found, and the symptom is dismissed. If you or a loved one develops new urinary urgency or frequency, especially when combined with walking changes, confusion, emotional shifts, or word-finding problems, you must insist on a complete neurological evaluation. This strongly suggests brain-related vascular changes. Brain, what you must do next. If you recognize multiple signs in yourself or someone you love, first, don't panic, but also don't delay. Step 1, document everything. Write down what you noticed, when it started, how often it happens, what makes it worse or better. Specific examples matter. Step 2, schedule a doctor's appointment. Start with a primary care doctor. Bring your notes. Step 3, ask for a complete evaluation. Request cognitive testing, brain imaging, and vascular health assessment. Do not accept
normal aging as the final answer if changes are clear. Step 4. Protect vascular health immediately. While waiting for evaluation, control blood pressure, manage diabetes, stop smoking, and eat heart-healthy foods. Stay physically active. These steps directly improve brain flow. One final important message. Vascular dementia is different from Alzheimer's. It is caused by blood vessel problems. That means early action can slow progression. Some damage may be prevented. Quality of life can be preserved. Having 1 or 2 signs does not mean dementia. Many conditions can cause similar symptoms, but recognizing patterns and acting early can change someone's entire future. Which of these signs surprised you the most? Have you noticed any of these changes in yourself or someone you love? Share your thoughts in the comments. Your experience could help another family recognize warning signs early. If this video helped you, please like and subscribe. We create clear, evidence-based health content for adults over 50 and their families. And please share this video, because recognizing these signs early may protect someone's independence, dignity, and brain health. Knowledge matters, but action matters more. If the signs are there, make the appointment today.